Hello, this is Shay Sullivan, and this is my sister's boyfriend.
Hi.
This is Jacob, and the date is January 28th?
February.
February 28th.
February 28th.
2020.
And we are going to go over our synovial joint movements. So first we have flexation and extension. So flexation is a movement that decreases a joint angle. And then extension is a movement that straightens a joint and generally returns a body part to the zero position. And then next we have abduction and adduction. So this is the movement of a body part in the frontal plane away from the midline, and then a movement in the frontal plane back toward the midline. And then we have elevation and depression. So that is a movement that raises a body part vertically and then lowering that body part back to its regular positioning. And then awesome job, Jacob. We're cruising. And then we have protraction and retraction. So that is the positioning you make when you push a door open. So that's moving a body part in an anterior fashion towards the horizontal plane and then back towards the posterior plane. And then we have circumduction. And so that's circumduction. So that's when one end of an appendage remains fairly stationary while the other end makes a circular motion. And then we have rotation. So rotation is defined as the movement in which a bone spins along its longitudinal axis. And then we have supination and pronation. So supination of the forearm is a movement that turns the palm to face anteriorly or upward. And then pronation is the opposite movement, causing the palm to face posteriorly or downward. And then last but not least, we have dorsiflexion and then plantar flexion. So let's see. Dorsiflexion is a movement in which the toes are elevated, and then plantar flexion is a movement of the foot so the toes point downward. All right. I think that's it.
That's it.
Thank you, Jacob.
You're welcome.